Hi everyone, my name is Brianna McClone, and today I'll be discussing how integrating ERAS protocols into the electronic health record can improve perioperative outcomes, streamline workflows, and support multidisciplinary care. Enhanced Recovery After Surgery, or ERAS, programs are evidence-based multidisciplinary pathways designed to optimize perioperative care. They were first introduced in colorectal surgery in the early 2000s, but have since been applied to many specialties, including bariatric, breast, gynecology, and orthopedic surgery. ERAS protocols aim to reduce perioperative pain, shorten hospital stays, and decrease overall opioid use. The success of ERAS protocols depend on the coordination between surgeons, anesthesiologists, nurses, and other care members. Despite decades of evidence supporting ERAS protocols, compliance remains inconsistent across institutions. Barriers can include fragmented communication, lack of standardized documentation tools, and resistance to workflow change. During my clinical rotation at Bridgeport Hospital, when trying to use ERAS protocols, I find them hard to locate in the chart, limited compliance between team members, and lack of communication. So oftentimes we're not sure who's done what and how much we've accomplished with each ERAS protocol. ERAS protocols are evidence-based. The literature shows many studies that support the use of ERAS protocols. This one study in green was a meta-analysis of over 9,000 patients where hospital stays were reduced by nearly 2 days and complications reduced by 30%. Another study found that outcomes for patients improved dramatically when adherence to ERAS protocols exceeded 75%. Everyone on the care team will play an important role in improving adherence to these ERAS protocols. Having a champion of practice in each department can help motivate staff and ensure adherence to the protocols. Collaboration is key as each team member contributes to better patient outcomes. To improve compliance at Bridgeport Hospital with ERAS protocols, I'm proposing that we use informatics to integrate a procedure-specific checklist into the electronic health record. This checklist would populate automatically once surgery was scheduled and follow the patient throughout the care. So that would include pre-op, intra-op, and PACU. This would give all care team members real-time visibility and would stay on the side of the screen to serve as a reminder for the things that have been done and still need to be done. This checklist would be live and interactive on the patient's screen. So team members could see the tasks that are completed, add notes as they see necessary, flag any barriers for things that were not completed, and track their contributions as well as other team members. The checklist would include automated reminders that would keep everyone on the same track. This would transform the electronic health record from a passive documentation tool that lives somewhere in the intraweb or on paper form into an active clinical decision support system that followed the patient through their surgery. The upfront cost would really be for the software development that's required to customize Epic in this way for the ERAS protocols. But minimal staff training would be needed since most employees are already familiar with the ERAS protocols and are familiar with charting in Epic. And any of the investment costs upfront would be offset by the cost savings. One study showed that for every $1 invested in ERAS protocols, the cost savings is usually $1 in return to up to $7 in return. So we already know that ERAS protocols are evidence-based. So by improving compliance, we know that we can decrease complications and decrease hospital length of stay, as well as decreasing overall opioid consumption. They are also proven to increase patient satisfaction and team communication and accountability. In conclusion, embedding an interactive ERAS checklist into the electronic health record at Bridgeport Hospital would help transform static protocols into real-time workflows. This supports communication, accountability, and consistency across the perioperative continuum, leading to improved patient outcomes and more efficient hospital operations. Future evaluations should focus on compliance rates with these checklists and patient outcomes, as well as provider satisfaction. And these are my references. So thank you very much, and I hope you enjoyed my presentation.